Imagine a tiny detective working to uncover vital clues about your kidney health. When a doctor needs to understand exactly what is happening inside your kidney, a small sample, called a biopsy, is taken. But what happens to that sample after it leaves your body? This is where a specialized medical expert, known as a pathologist, steps in. A kidney biopsy is analyzed by pathologists using a meticulous process involving advanced microscopy and specialized staining techniques to identify the specific type and cause of kidney disease. Their goal is to provide a precise diagnosis that guides treatment decisions and predicts how the disease might progress. The why behind this detailed analysis is critical. Kidneys can be affected by many different conditions, from inflammation and infections to various types of cancer. Each condition presents with unique cellular patterns and changes. By carefully examining the biopsy sample, the pathologist can differentiate between these conditions, which often look similar clinically but requiring very different treatments. For instance, distinguishing between different forms of glomerulonephritis, an inflammatory kidney disease, is essential because each type responds to specific medications. To analyze the biopsy, the pathologist follows several key steps. First, the tissue is prepared by fixing it in a special solution, embedding it in paraffin wax, and then cutting it into extremely thin slices. These slices are mounted on glass slides and stained with various dyes. These stains highlight different cellular structures and components, allowing the pathologist to visualize details under a light microscope. Additionally, sections may undergo immunofluorescence, where fluorescent antibodies are used to detect specific proteins or immune deposits, and electron microscopy, which uses a beam of electrons to magnify the tissue at an even higher resolution, revealing ultrafine structural changes. An important insider detail in kidney pathology is the concept of glomerular counts and tubulointerstitial fibrosis. Pathologists don't just look for obvious abnormalities. They also meticulously count the number of healthy versus damaged glomeruli, which are the tiny filtering units of the kidney. They also assess the degree of scarring, known as fibrosis, in the tissue between the tubules. These quantitative measurements are not just descriptive. They are crucial prognostic indicators, helping doctors understand the severity of the disease and how much kidney function has been lost or preserved. Ultimately, the pathologist's thorough analysis provides an accurate and detailed picture of your kidney's condition, transforming a tiny tissue sample into actionable insights. This precise information empowers your medical team to choose the most effective treatment plan, optimizing your path toward better health and a clearer understanding of your kidney journey.